This is probably the most common question that we get during pregnancy, and it does vary a little bit depending on what your weight was entering pregnancy. So very underweight women, or more commonly women that are overweight or obese, will get slightly different recommendations from their doctors. But for average healthy weight women coming into pregnancy, we recommend about 25 to 35 pounds of weight gain in total over the course of pregnancy.
I think it's important to remember that to gain 25 to 35 pounds really doesn't take eating a whole lot of extra per day. It's only about 300 calories per day. And if you think about what kind of foods you want to gravitate toward, we recommend protein in general as a food source to favor in pregnancy, because both the developing fetus needs a lot more protein to grow, and also mom's body is expanding in ways that are really important for a growth state. Her blood volume is going to expand by about 50% during the pregnancy. Her uterus grows a lot larger, and all that growth really requires a lot of protein, but really only about 300 extra calories per day. So in pregnancy, a woman wants to avoid undercooked foods, so being very careful about raw food or undercooked food, sushi, undercooked or non-cooked meat, deli food that has been potentially sitting out, particularly deli meats, can harbor something called listeria, and this can be pretty severe for both the baby and mom during pregnancy. It can lead to miscarriage.
The recommendation about cheese is really to avoid unpasteurized cheeses. Those tend to be cheeses that are the soft cheeses or some cheeses from other countries. If it's sold in the United States, you can usually look at the label and see whether or not it's pasteurized. We definitely recommend that women not consume alcohol during pregnancy and avoid other substances, illegal substances, of course, things like that. Caffeine in general is okay to continue during pregnancy, coffee, teas, other products that contain caffeine, but we recommend that you not exceed what would be in about a small cup of coffee on a daily basis, of regular coffee.
And I want to add to that, given the changing legal status of marijuana, there's more data coming out that marijuana use in pregnancy is not safe and is not healthy. There's an increased risk of poor growth of the baby and also increased premature birth.
I recommend women take one prenatal vitamin per day. So that can be any of the prenatal vitamins that are sold over the counter. All prenatal vitamins should contain something called folic acid, and that's the most important component of those prenatal vitamins. So you can just go to your drugstore, pick up the bottle, look at the back, make sure it contains folic acid. And if you're taking one prenatal vitamin containing folic acid a day for average, normal, healthy patients, that's all the vitamins you should require. So I get asked about omega-3s frequently by patients, and I personally feel that the data is not strong in this regard, in the sense that I haven't read any compelling studies so far, and we don't have society guidelines so far that suggest that women absolutely need to take omega-3s or supplement omega-3s during pregnancy. If that's something that you're already doing or have read about or feel that it's important to you, it's safe and fine to continue, but I don't make a strong recommendation that patients do that.
Omega-3s are part of any good, healthy diet, and if one gets omega-3s through a diet, that's fantastic. One good source of omega-3s is fish, particularly fish such as salmon. With that said, it's important to limit fish consumption in pregnancy. The recommendation is to limit it to 12 ounces per week, and really to avoid those fishes that are high in mercury. And in general, those are the larger fishes. Kingfish, tilefish, mackerel are three of the biggest. Swordfish is very high. Those large predatory fish concentrate more mercury and are high sources of mercury. I think it's great to continue exercise in pregnancy, and that's the key, just continuation of a program that one already has in place. Pregnancy is not the time to become a runner if a woman's never been a runner before, but continue in whatever exercise program she already has. And if she doesn't have a significant exercise program, at least walking on a regular daily basis for at least 30 minutes is important. Exercise in pregnancy, or when a pregnant woman exercises, she may be surprised to find how quickly her heart rate rises. We know that in pregnancy, a woman's heart rate is about 10 beats faster than normal, and even a small amount of exercise really pushes her cardiac output pretty significantly. And we tell women to keep their heart rate's under 140. And even if someone runs normally, she might be surprised by how quickly her heart rate can get to 140. So either using a heart rate monitor or just checking one's own pulse is important during pregnancy.
And another thing that women can consider, especially as they approach the latter part of their pregnancy, the third trimester, is something that we call the talk test or the conversation test. So if you're able to carry on a casual conversation while you're exercising, whether that's walking, if you're a jogger that can talk while they run, if you're able to continue to carry on that conversation, that's a good sort of superficial test to make sure that the amount of exercising you're doing is acceptable for pregnancy. I think that there is some confusion, especially now, about the difference between genetic screening versus genetic testing. This is partly because we've had some pretty recent technological advances in terms of what we can offer to pregnant women during pregnancy to screen for genetic conditions. So women that know that they have a family history of something that can be inherited, or if they have a pregnancy that was previously affected by an anomaly or abnormality in the baby or an inherited condition, it's very important for them to talk to genetic counselors or to talk to a high-risk pregnancy specialist about what type of tests can be done to screen for this type of condition recurring in a current pregnancy. For people that don't have any of those issues in the past, which is going to be the majority of women, we would offer testing during pregnancy to screen for more common chromosomal aneuploidies, meaning the baby having the abnormal or wrong number of chromosomes. And these screening tests can be done through blood testing and some ultrasound assessments.
And I think it's important to know the difference between a screening test and a diagnostic test. A screening test is a test that gives you a sense of how high your risk is. So 1 out of something, 1 out of 100, 1 out of 1,000, 1 out of 10,000. Those are very different numbers in terms of whether that individual may be affected with whatever condition the test is looking for, as opposed to a diagnostic test, which will tell a woman whether the baby carries one of these conditions. Diagnostic tests include things like CVS and amniocentesis. That's an invasive procedure, and it's important to know that there's typically a cost to those procedures in terms of the risk of a pregnancy loss. And that risk is typically quoted as about 1 in 300. So in 1 in 300 times that one of those procedures is performed, that woman may lose the pregnancy as a result of that procedure.
Pregnancy is an exciting and special time. For women in their first pregnancy, it's also a time that comes with a lot of new experiences, new sensations, and sometimes new discomforts. Many of those things are normal and safe and nothing to worry about, but it's always good to check in with your doctor. We can often offer some tips and suggestions to make the weeks or months ahead of you a little bit more comfortable.